Good morning. Thank you for joining today's webinar on Working Together to Save Lives in Emergencies, Initiatives and Tools to Support Breastfeeding in Emergencies. My name is Julia Crowley and I'm with the TOPS program. Before we get started, I want to go over a few logistical details for today's webinar. Please note that all microphones are turned off for today's webinar. So if you have any problems with the audio, please enter it in the chat box, which is to the right of your screen, and we will work with you to solve any problems. During the presentation, if anyone has any comments, questions, or would like additional details, please enter it in the chat box, which is the same to the right of the screen, and your questions will be answered following the presentation. At the end of World Breastfeeding Week, the presentations will be posted online at the FSM Network website. I will now hand this over to Joan Jennings, Nutrition and Food Technology Senior Specialist at the TOPS program. Thank you.
Welcome to the second day of the USAID World Breastfeeding Week webinar series. Today we will continue to highlight the ways in which USAID implementing partners work to sustain progress in breastfeeding together, with a presentation from Save the Children about supporting breastfeeding in emergencies. You can see on your screen the list of these webinars in this series. Yesterday we had an excellent presentation by Justine Kabla of the Maternal and Child Survival Program on barriers to breastfeeding, findings from a systematic review of practices in 20 countries. Be sure to join the rest of this week's webinars, which last approximately 1 hour each, to hear about breastfeeding in the context of HIV-free survival, human milk feeding for small and sick newborns, and the Baby-Friendly Hospital Initiative. Also, there are additional resources available, and we would like to call your attention to a few things. We hope this webinar series contributes to a focus on the promotion, protection, and support of breastfeeding. In August 29th in 2016, USAID with their partner FHI 360 and partners Fanta and Alive and Thrive held a breastfeeding symposium. This year, in May 9th to 11th, the TOPS program with support from Food for Peace hosted a breastfeeding seminar. You can see more information from both of those presentations on those websites. In addition, on SUN, if you go to the SUN Civil Society Network, you can find information on another set of webinars that are going on this week. And on to next week in support of World Breastfeeding Week. A Civil Society Guide to the International Code of Marketing of Breast Milk Substitutes, and new global guidance on marketing infant foods. The first one will be today. Those times are Greenwich Mean Time. So for those on the east coast of the U.S., that will be 11 a.m. So, and for now, I'd like to present Sarah Butler. Sarah is an advisor and team leader for Save the Children's Emergency Nutrition Team with over 10 years of experience. She also co-chairs the Save the Children Emergency Nutrition Working Group, a coordination body for emergency nutrition work throughout the Save the Children global movement. Sarah's day-to-day work focuses on country office technical support, global representation, thematic leadership, and coordination. She holds an MPH and Master of International Affairs, both focused on forced migration and humanitarian affairs. I will now turn it over to Sarah to begin the webinar.
Good morning, everybody, and thank you to USAID and to TOPS for inviting me to present on how we can work together to save lives in emergencies. It's really fantastic that 1 out of 5 of these webinars is focused on the emergency context, given the additional risk that children face in emergencies and the additional impact that we can have in making things just a little bit better, a little bit more survivable, I suppose, in emergencies by helping moms and parents in their support and nurturing of their children. This webinar will follow the 4 pillars or the 4 objectives of World Breastfeeding Week. The first being, of course, to inform and understand the importance of infant and young child feeding in emergencies, to then look at how we can anchor ourselves in how we can do activities and protect, promote, support breastfeeding and children under the age of 2 in emergencies, then to look at how we can engage with one another to reach out and utilize tools that have come together through partners working together and bringing best practice to bear, as well as partnerships at the global level to once again create environments that are breastfeeding friendly, let's say. These are the 4 in particular that I'll be mentioning during this presentation, and I hope that with these additional tools and more knowledge on these initiatives, that folks will feel galvanized to protect, promote, and support breastfeeding and indeed infant and young child feeding in emergencies. And throughout the presentation, you'll notice that I will talk about infant and young child feeding in emergencies versus focusing entirely on breastfeeding. This is quite on purpose to recognize that sometimes when we talk about breastfeeding, there seems to be a focus on those children 0 to 6 months during that exclusive breastfeeding period. But in emergencies, I also really feel passionately that we need to be reminding ourselves of the continued breastfeeding up to and beyond 2 years for the additional protection that affords children, particularly in situations of high infectious environments. Excuse me. So first of all, inform. Why is IYCFE important? And to this group, I don't imagine that I really need to spend much time on these slides. What we know very well is that in terms of highest risk of mortality, the younger children face the highest risk. This graph is from data coming out of Afghanistan from a therapeutic feeding center, and you can see that the percentage of deaths and admissions of children under 6 months is 17% in comparison to the 5% faced by children between 48 and 59 months. The risk to the youngest children is absolutely the highest, both in non-emergency and emergency contexts. We also very well know that if adopted at a high coverage, interventions focused on infant young child feeding, breastfeeding exclusively through to 6 months, and then continuing up at least until 12 months, could avert 13% of deaths in children under 5, and that complementary feeding, according to the recommendations by WHO, could save an additional 6% of those preventable deaths in children under 5. So together we could be averting 1 in 5 deaths. And at the end of the day, the tagline really is that improving breastfeeding practices could save more than 800,000 lives every year, but that breastfeeding can be easily undermined unless we're all working together at multiple levels and across multiple sectors to support mothers, caregivers, families to adopt these recommended behaviors. And when I talk about these, I'm really focusing in on breastfeeding within the first hour, exclusively through to the 6 months, and then at 6 months, introducing complementary feeding with adequate energy and nutrients that is hygienically prepared, stored, and used, and then appropriate feeding, including active feeding and continued breastfeeding, of course, up through at least 24 months and beyond. I included this graph, or this pictorial from IBFAN, just to highlight that, again, that period of continued breastfeeding can be such a protective intervention or protective behavior for children in emergencies, particularly in situations of food insecurity or food scarcity, to receive the majority of their nutrients from breast milk almost until 2 years of age can really mitigate some of the risks that we face in emergencies. And at the moment, we're talking about near famine conditions in multiple countries, from Nigeria all the way over to Yemen. So let's also, when we talk to our colleagues and when we work to support beneficiaries, keep in mind that 2-year mark and even beyond that 2-year period. Why do we talk about breastfeeding? I think I'm preaching to the choir here, absolutely, but just to ensure that we're at the same level of understanding that in terms of breast milk, it provides perfect nutrients, it's easily digested and efficiently used by an infant. protect against infections. That's a really important aspect, particularly with high infection rates and emergencies. And of course, the cost that it wouldn't bear the cost that we would see with artificial feeding. In terms of the breastfeeding relationship, that help in bonding and development and the potential mitigation or protection against maternal depression, for instance, and other mental health concerns. The delaying of pregnancy when we're in the field ourselves, working with our colleagues, and for instance, on a recent trip to the Democratic Republic of Congo, one of the number one pieces of feedback that we're given was that family planning helps with being able to provide adequate and the amount of nutrition that they were, but that as well, breastfeeding helped them to delay that next pregnancy, which was important for moms, and the protection for mother's health in terms of particularly ovarian cancer, breast cancer, uterine cancer, and things like this. It's important as well to note the comparison between exclusive breastfeeding and children who are not breastfed. In terms of all-cause mortality, we can see that children who are not breastfed face nearly 15 times, let's be accurate, 14.4 times higher risk of all-cause mortality. This statistic and all of this information is it's not taken from emergency context. So we can imagine that when children are facing even higher risk of diarrhea, pneumonia, in those contexts of forced migration, that these kinds of impacts can really not be understated. So now let's move over to emergencies and consider the risks faced by children when we when we do not breastfeed. And this photo is taken from Syria. It could be taken in so many different contexts in which we work, in which water is scarce or water is contaminated, where folks are living in overcrowded conditions and on the move, where they have limited or insecure supplies and resources to properly sterilize, and where there is a continued risk of bacterial contamination. This obviously isn't the picture that infant formula companies would like us to be showing, but this is the reality in emergencies, the reality that moms are facing when potentially their own confidence in their ability to breastfeed has been destabilized, when they might not have confidence that they have received enough food or water, or have other kind of misconceptions in mind that might stand in their way of having that confidence that they can provide all the food that is needed for a child up to 6 months, and that comfort as well, particularly in situations of trauma that children and families are facing. This evidence came straight out of a post-earthquake response in Indonesia. In 2006, there had been untargeted distribution of infant formula in this earthquake. There were some household surveys that went out and surveyed how many children in those households had incidents of diarrhea. In the households that received untargeted distribution of infant formula, prevalence of diarrhea was 25% over the last 7 days, and in households that had not received those donations, prevalence was 11%. And this just goes to show that one of the real challenges that we face in emergencies is oftentimes quite well-intentioned efforts by organizations that potentially aren't as well-informed on the negative impacts that can result from untargeted distribution of breast milk substitutes. This distribution within Indonesia had direct impact on the feeding practices in these households, and you can see the increased risk that those infants were then facing as a result. So at the end of the day, breastfeeding saves lives in emergencies all over the world. We know this. We know that breastfeeding is an amazing intervention that moms can be empowered to provide to their infants, and we know the absolute impact that we can be having. But the real question there is then, what can we do? How can we anchor ourselves in some of these activities of how to protect breastfeeding? So apologies on this slide. It's a challenges to optimal feeding that should really be recommended feeding practices. We tried to catch them on all the other slides, but this one slipped through. So again, I'm not sure how many of the folks who have called in have had experiences in emergencies. So I just wanted to remind us of some of the challenges that are facing moms and children. at the moment and over the last number of years, we've really been challenged in situations like in Syria where we had low pre-crisis breastfeeding rates. Oftentimes we go into these emergencies and we're trying to mitigate the decrease of exclusive breastfeeding in a country. But when you're coming into a situation where that was already low, it's quite challenging to affect the changes that we're quite interested in making, that we know that with coverage we can really avert death. So that's one of the challenges. And you know, a combination here is as well that kind of breastfeeding support that you might have in a culture that's that has quite high levels of breastfeeding. There isn't that same social network and social support when potentially access to breast milk substitutes is stopped, and mothers are trying to figure out how are they going to feed their children if the people around them have not breastfed their children. Where do they get that information and support themselves? There's also a poor understanding of infant young child feeding sometimes, and we're seeing changes through a lot of the initiatives that we'll talk about today and initiatives undertaken by a lot of other agencies as well. But we were facing a challenge of poor understanding of what infant young child feeding support really means in an emergency, as well as weak legislation, areas where the code wasn't understood or wasn't being endorsed or followed through on, that could really undermine and allow for instance, untargeted donations of breast milk substitutes. And I have to say that this photo, I really struggled whether I should put this in because it hurts my heart, to be quite honest. This baby was the third that this mother had in Pakistan, and unfortunately her previous two babies passed away, and she was absolutely convinced that her breast milk had been the cause of the deaths of her previous children, so she hadn't breastfed this baby. And when he came to save the children, he was already quite malnourished, only 3 months old, because the mom had been feeding, had not been breastfeeding him basically. So she received the support that she needed, and she was able to start breastfeeding again. But the look on this baby's face, just you can imagine how heartbreaking it was for this mother after losing 2 other children to be looked, to have her baby look at her with this kind of pain. So at the end of the day, the challenges that we see in emergencies could be borne out in many other situations where there's potentially a lack of support or lack of information for breastfeeding. But additionally, food insecurity, poor access to water and sanitation, population movement and living conditions, and exposure to stress and trauma can have additional impacts on a mom's ability and confidence to breastfeed. So what are we talking about with infant young child feeding in emergencies? There are really 3 aspects here. We're talking about protecting and supporting breastfed children. We also cannot forget about non-breastfed infants, particularly in contexts where we have high prevalence of the use of breast milk substitutes. In an emergency, we need to ensure that those children are protected as well. And then appropriate complementary feeding. So we're not just talking about breastfeeding, but how to support a child all the way up through 2 years, how to support continued breastfeeding, and how to protect and mitigate against the impacts of using breast milk substitutes. To answer the question of, well, what is it that we're talking about? What do we do in infant young child feeding in emergencies? We can use the same kind of causal analysis for nutrition that so many of you will be very familiar with. And I just wanted to highlight this to bring across that multi-sectoral approach, that we can increase impact and reach, efficiency and cost effectiveness, and find a whole amount of synergy and complementarity. And this final bullet point of accountability for me really resonates in terms of being accountable to moms in emergencies, that we remember what the situation is that they are facing, that their partners are facing as well in their attempt and their striving to protect their families and provide the best start to their children. The way that we can be the most accountable to these moms is by working across multiple levels, across multiple sectors to ensure that they have what they need to protect and nurture their children. In terms of interventions, the primary aim and the very first thing we think of in infant young child feeding in emergencies is doing no harm and immediately saving lives. And we take a public health approach to this, trying to reach as many people as we can. And so that base of the pillar is one that we
which we would like to advocate that folks really pay attention to in the very first days of an emergency, looking at communication, advocacy, and policy that can reach as many people as we can do. The next up is enabling environments. These are non-targeted activities that support infant and child feeding in emergencies, to support moms and caretakers to, again, have access and protection and prioritization in an emergency for things like food distribution or access to water and health care. That red level is your basic targeted support. These by no means are meant to be simple interventions. They're not. It seems everything is a little bit complicated in emergencies. But these are very much multi-sectoral activities that can be targeted to support breastfeeding. Things like making sure you know how many children are in an emergency under the age of 6 months, how many of these infants might need some support in terms of more technical, specialized support. And there's very much a blur between the red and the yellow there in terms of assessing needs and acting to support those mother and baby pairs that need additional support. The technical specialized support is really talking about case management for those mother-baby pairs that need support in emergencies. So now I'd just like to sort of introduce some of the tools and guidance and partnerships that I'd really like everybody to know about so that we can support and encourage everybody on the phone, but as well our partners and our colleagues to consider infant young child feeding in emergencies. And you can't go very far without mentioning the Bibles or the Qurans that we lean on. Of course, we're talking about the use of the code. We're talking about, in emergencies, the SPHERE project and the infant young child feeding in emergencies operational guidance. These guidelines are really the same that we use in emergencies and that we seek to put in place and protect. Just a note in particular on the IFE operational guide. So this is this photo is from the previous version in 2007, I believe it was produced. It's important to note that this year there will be a revision of the OPS guidance, and quite in line with the World Breastfeeding Week theme of sustaining breastfeeding together, there's a much stronger focus in this next version as well on multi-sectoral efficiencies and work that we can be doing that we absolutely cannot be supporting breastfeeding and mothers who are breastfeeding unless there is as well a consideration of the needs of that family in terms of water, access to hygiene materials, access to food, access to all sorts of different health care, different services available in an emergency. But the OPS guidance very much encourages us and gives us guidance on IYCF assessments to determine the actions that are needed, policies and coordination, and more information on those basic and technical interventions. I also understand that these terms, in terms of basic and technical, will not be in the new guidance, but that's still the examples and the recommendations of what we can be doing to protect and promote and support breastfeeding will very much be laid out. The next tool I wanted to highlight was the Infant Young Child Feeding and Emergencies Toolkit. And our hope in pulling this toolkit together at Save the Children is that we can bridge that gap between what we know exists at the global level. There's a host of guidance. We just showed a number of them. But what we found in doing a landscape analysis a few years ago was that there was a gap between what folks knew and what folks felt confidence in doing in an emergency. And so it really called out to us the need to create this compendium of best practice and tools across agencies so that if an individual needs to respond to an emergency, whether that's somebody from the U.S. or Europe deploying into a large L3 emergency, for instance, or if we're talking about somebody within a context who's deploying within their own country or their own community at short notice, that they have the tools that they need to ensure that services are reaching mothers as quickly as it can. So to give an idea, this was the problem that we were facing. We found that there were a lack of these operational resources available and therefore a lack of clarity on what folks could do in emergencies. So our response was to compile these guidance, templates, implementation, guidelines, and policies. We did not start from scratch on these. These tools are not Save the Children alone. These are very much collaborations with partners working together to identify, right, we found that these are really useful tools. We'd like these to be available to a wider community. So we very much encourage this toolkit to be widely owned, widely accessible. The funding for this toolkit came from the TOPS program, which is funded by USAID, of course, as well as some Save the Children internal funds. Currently, we have funding from OSDA to revise this toolkit, but as well, importantly, to use the toolkit in a series of both nationally focused and regionally focused infant and young child feeding and emergency training. We just completed a training in Yemen last week, and we're able to include some sessions on cholera and infant and young child feeding and emergencies. How do we support mothers and babies who are under the age of 2 years, especially those kids under the age of 6 months if their mother has contracted cholera and the baby is still healthy? What are we doing to support that that mother-infant pair? How are we supporting breastfeeding once one of them has been discharged from the cholera treatment centers? Much more work needs to be done in this field. The toolkit, this toolkit is massive. Please don't be overwhelmed if you're going into it. There are 400 documents through 9 folders. You can see the 9 folders here, and it really is our attempt to highlight all sorts of different aspects of building out an infant and young child feeding and emergency program. We have very useful tools in terms of assessing the need, doing your needs assessment, developing your proposals and budget, designing that program, calculating what are the numbers that you're expecting in your program. This can be really challenging in terms of supporting breastfeeding and emergencies, as well as, quite importantly, and very much paired to this, how much supply do you need to be meeting that need? What is potential staffing that you want to be looking at, as well as very helpfully job descriptions, some training resources. And that last bullet there, I don't want to read all of them, but the last bullet there, coordination and communications, again, so important in immediate aftermath of an emergency to ensure that the right messages are going out to protect, promote, and support breastfeeding. Each of those 9 folders is divided into 3 subfolders. So you would find key concepts to give folks an overview or summary of that topic area. Then the annexes, which is quite large as well, looking at tools and templates and examples that folks can be using in communications or caseload calculation. And finally, references, and these are the global references from WHO and UNICEF and other partner organizations that you would be looking to learn much more and gain that in-depth knowledge. So where are these tools? They are currently located on a Google website. They will be migrating soon to an externally facing Save the Children website. You can download the toolkit either as a zipped folder or individual documents can be downloaded as well. And we've included those 2 options really to speak to low connectivity situations or situations where you might be deployed into an area that has really been devastated and that would not have Wi-Fi, as you can imagine. So you can download those before deploying. These core documents are also available in French and Arabic and are available on the website. And very important as well is that we have this email address, IYCFtoolkit@savechildren.org. This is that you can give us feedback. This continues to be a consortium tool. This continues to be a tool that we're looking for best practice and advice from partners across the community of what you think would be valuable. I'm also quite excited to have sort of non-emergency focused individuals on this call as well hearing about this, because I'm absolutely convinced that we can be learning from and taking guidance from development programming or from programming not in emergencies. There's so much overlap between IYCF and IYCFD and supporting moms to sustain breastfeeding. There's no need to be reinventing the wheel here, so there's a lot more learning that we can be doing across that continuum. Just as an example of the toolkit, the toolkit, here are 2 examples from a colleague that was deployed out to Syria to support the cluster. In the toolkit, there's a terms of reference for what you might want to include in a subgroup focused on infant and young child feeding and emergencies. This would be a coming together of partners looking to implement programming. At the time that this colleague deployed, there was not an existing working group. They didn't quite know what they would be taking on or how they should be organizing themselves. And just having this generic TOR helped them to discuss what would work for them. So they were able to clearly then outline and improve their coordination and their roles and responsibilities. Another example was from that communications coordination folder that I highlighted. There are 2 tools in there, an IYCFE media guide flyer and a media responsibility on IYCFE. The output here was that they had better informed media comms teams. And the outcome being that actually they found there was a cessation of demand for infant formula donations on social media and websites. There was positive messaging on breastfeeding, and there were plans to start online IYCF campaigns. There can be such benefits and impact to partnering with our media and communications colleagues. And one of those examples here, she provided 2 articles. The first article before starting to use these tools really talked about shocking, starving children that had no access to any food. And afterward, there was an entire article that was published around the importance of breastfeeding, the dangers of untargeted distribution of breast milk substitutes, and how agencies could be supporting moms to breastfeed in an emergency. So real great success here. In terms of how we can engage with one another, there are 2 partnerships I wanted to highlight here. The UNHCR Save the Children Framework, this is the IYCF Framework, and I just want to highlight this is an IYCF or breastfeeding caravan in Zatri Camp in Jordan, run by Save the Children Jordan, and I believe now taken up by a number of other agencies. And I just love the visuals of this caravan and knowing the support the moms are receiving within it. So just to highlight, the IYCF Framework is an initiative that looks to give guidance to partners working in refugee contexts, but relevant throughout emergencies, to assist with integrating and mainstreaming international policies, standards, and guidance on IYCF with other sectors operating in the context. There are 7 primary actions that it advocates for. The first, advocating and mobilizing resources, endorsing key policies, looking at what are the appropriate activities to support breastfeeding and infant young child feeding, how do we integrate with other sectors and coordinate on these activities, and finally, how do we measure them, how do we monitor, evaluate, remain accountable, and learn from these activities. The graphic on the side really highlights that the entire framework is built with the mother-baby pair in the center, so that whatever we are doing, whenever we walk into an emergency, we keep those 2 in mind. What would they need? What can we imagine that is going to help them in this context? In that framework, there are chapters looking at sector integration and sort of mainstreaming, I'll put quotation marks around that, of IYCF across the sectors you would find in an emergency. There will as well be 2-pagers per sector to summarize some of these that we can use as nutritionists to meet with our colleagues in the water, sanitation, hygiene community, or in camp management, for instance. Each of the sector chapters go over our common strategic objectives, which really resonates to me on the World Breastfeeding Week objective of engage, reaching out to others to establish common interests. And it's absolutely at the core of this framework, because it's not just how can WASH support IYCF, but also how can our relationship with moms support some of the objectives in the water and sanitation sector, for instance. Where are the overarching opportunities for collaboration, and importantly, what are the resources? So in terms of this framework, it will be available on the UNHCR website. It's currently undergoing finalization in terms of packaging and branding within UNHCR. There's also an additional tool, the IYCF Framework video, that you can access at YouTube. This is currently available. Here are some screenshots of it. The video, we welcome you to use it with your colleagues and in your work. It follows a mother named Sarah. She's just arrived at a refugee camp, and it goes through some examples of how each of the sectors can support this mom in sustaining breastfeeding. It's a great video. I really welcome you to look at it when you have the chance. We had pilots in Zatri Camp in Jordan, Cox's Bazar in Bangladesh, and Dadaab Refugee Camp in Kenya. I'm not going to read this whole slide because I know we're going to become short on time, but just to highlight some real successes here. After using the IYCF framework, there were meetings with multiple different sectors and individuals on what are we talking about IYCF, what are we talking that camp management committees can support IYCF. There were meetings with that camp management committee, and they then took leadership on recommending for partners advocating for the endorsement of labor laws within Jordan that hadn't been endorsed in the refugee camp situation. So after this kind of this legislation endorsement, now across Zatri Camp there are breastfeeding breaks that agencies have adopted so that moms have an hour every day to breastfeed their child if they have a child under the age of 1. And you can imagine as a working mom how facilitated that is to have a break to go ahead and breastfeed. And the result of that was that they did find that breast milk substitute usage decreased within staff working within the camp. There was also a way that you could kind of double check which organizations hadn't endorsed yet that policy. The Camp Management Committee as well, that third bullet, worked closely with the police department working on Zachary Camp, and they identified a breastfeeding champion within that camp police department and ensured greater adherence to the standard operating procedures for handling of BMS, so that by the end of it there was a removal of breast milk substitute from camp shops. This is absolutely in the context in which there was otherwise access to an alternative guaranteed supply with the associated support that might be needed, or that would absolutely be needed, for mothers using breast milk substitute. But what an accomplishment to actually remove breast milk substitute from shops, so that when mothers made that decision, they also had, along with it, they could access counseling and advice and some additional knowledge. In Cox's Bazar, Bangladesh, there was a lot of integration with other sectors, key messages and counseling, for instance, through voucher programs and food distribution. And I also wanted to highlight here referrals between the Infant Young Child Feeding Program and the mental health unit to identify moms that might need additional support here, as well as with, for instance, a water sanitation team, when our house-to-house visits by nutrition counselors found that actually this family, the hygienic condition of this household are not appropriate for a child under the age of 2, this family needs additional support from the WASH team, and then that referral would happen. In Dadaab in Kenya, again, lots of good integration, referral pathways strengthened for abandoned, separated, orphaned infants, and registration of infants less than 6 months, which can be so facilitated to be doing infant young child feeding programming. We have referrals of mothers, and finally we had multi-sectoral BFHI committees with maternity and hospital staff, as well as agriculture, nutrition, cluster coordinators, reproductive health coordinators, to all come together to look at a BFHI friendly and facilitative community. There's much more information below at this link for an article that was published in the Field Exchange. The next steps of this framework is a rollout in East Africa in the latter half of this year, and then in 2018, UNHCR is rolling this out globally. So please, as we have partners working in refugee contexts, consider using the framework to generate conversations of how we can work together to sustain breastfeeding. But as well, I welcome you outside of refugee contexts. These activities aren't specific to refugees. They can be used in IDP and internally displaced programming. They can be used in development as well. So I hope that you will find it as a resource. Finally, the last partnership I wanted to highlight is the Technical Rapid Response Team. The TechRRT is a consortium led by International Medical Corps with a partnership with Action Against Hunger and Save the Children. The funding is from USAID, and it is in very close collaboration with the Global Nutrition Cluster and UNICEF. The TechRRT is a mechanism to support collective work for nutrition in emergencies. The TechRRT was initiated from a background where there was need identified that we were finding difficulty in accessing human capacity, human resources in technical fields and emergencies, that emergencies were becoming increasingly complex, and that we needed to ensure that we had overall an ability to deploy technical advisors and to provide remote support. The TechRRT is made up of 5 experts, one in assessment, IYCF CMAM, which is the management of acute malnutrition, and then one that has skills in both CMAM and IYCF, and finally an advisor in social behavior change. There's a deployment steering committee that works very closely with the Global Nutrition Cluster and UNICEF. These individuals can be deployed to lead, plan, and conduct nutrition assessments. They provide capacity strengthening for these technical areas. They can lead barrier analyses and develop SBC packages and determine need for scale-up. To date, there have been 19 deployments. This might already be 25 deployments across 9 countries. You can see that the greatest number of deployments has been in infant young child feeding and emergencies, and it really responds to this great interest to protect breastfeeding and to support babies under the age of 2 years, particularly under the age of 6 months, that folks are hungry to learn how they can support this. And so the TechRRT is a great resource. Just a final example here, The Tech RRT deployed an IYCF advisor to Northeast Nigeria. In late 2016, they organized a workshop with WASH. This is similar to what we were talking about in the IYCF Framework. That workshop, the objectives were, I'll just describe the objectives before I go into that slide. To describe what IYCF is and what they were doing, to talk about how WASH interventions could support infant young child feeding, and to look at priority integrated actions between WASH and IYCF. They used the World Vision Baby WASH approach, where they had identified ways that WASH can support various stages from conception all the way through to 2 years, that whole window of opportunity. And by the end of the workshop, they were able to identify some joint priorities, such as organizing joint assessments, advocacy to have the government invest greater in child health, ways to collaborate on activities to ensure that pregnant and lactating mothers had access to safe water, integrating baby excreta disposal given the additional risks there, cross-training, and importantly, referrals of children who are malnourished. The important part here is that these activities were feasible and that the output of this workshop were feasible integrated actions that were prioritized in designing WASH and nutrition programs in Borno State. What an opportunity here to work together and to ensure that moms have the support that they need and that families have that support. So finally, I'll just close again with this slide, that breastfeeding, we know breastfeeding saves lives. And you can imagine the additional impact that we have in emergencies if we can work together and we can galvanize each other and galvanize ourselves to really ensure that these activities happen in emergencies. And most importantly, that we work together on these activities, that these resources are out there, that everybody has access to them, that we welcome feedback and working in partnership. If you have a great tool, let us know that we can include it in the toolkit, for instance. So that's the close of my presentation. I hope that it has generated some good questions and some good energy, and I welcome your questions now.
Great. Thank you so much, Sarah. So our first question online is from Jennifer Yurkovich, who's asked, can you talk about relactation, challenges to relactation, and how non-experts could assist with the relactation in emergencies? And is this covered in the toolkit?
Wow. Jennifer, that's an amazing first question. Thank you for asking it. Relactation in emergencies. There's, I think Joan is going to be angry with me if I show this next slide because I wasn't meant to show it actually, because it's all about the top 10 questions of research, but now you've opened up the questions. Now I can show you that there are top 10 questions in young child feeding in emergencies. These have been identified by folks working in the field for questions that would be really important for us to answer to move this forward to help moms. And one of those is on relactation. I did highlight in red here that one of the top 10 questions here is looking at how we can link and mainstream IYCF interventions across sectors. So again, feeding into that sustaining breastfeeding together. But your question of relactation, at the moment, I'm not sure what resources are in the toolkit, to be honest. I would imagine that the WHO guidance on relactation is included in the toolkit, and that provides quite a good overview of what relactation involves. Save the Children currently has funding from OSDA to do an operations research study that will be hosted in Zimbabwe, and then with some additional funding to do some work in Somalia that's been identified by Save the Children to look at how are those relactation protocols, how do they speak to the emergency context? Are there challenges that we face in emergency that make the current protocols challenging to facilitate? So after doing data collection, we'll be designing this research so that we are comparing the current protocols with these optimized protocols for emergencies, looking at our results, and then by the end of July 2018 or by the end of 2018, you will be seeing optimized protocols for emergency that speak to some of these challenges that sometimes are not challenges that are technical, that you have to be an IYCF or a relactation specialist to support with. In terms of supporting a mom, the amount of commitment and dedication of a mom to relactate cannot be under highlighted here. It takes weeks for a mom to relactate to exclusive breastfeeding. It is absolutely possible, if that mother receives the support that they need, but it takes tremendous commitment, breastfeeding every 2 hours, and having the space and the opportunity to do that. So one of the main things that somebody can do is to support that mom, to support the family, to identify ways they can take work off of that mom's plate so that she can spend that time with the baby to ensure that the baby has skin-to-skin contact and frequent suckling to generate that hormone increase to produce breast milk. There's a lot. Relactation does require technical advice and support, but once that mother has that technical advice, there's a lot that we can do, that we would need to do to support the mom to be able to accomplish relactation. Thank you for that question. There was as well, there's a full presentation. Joe mentioned earlier the breastfeeding seminar. I presented on relactation and this research that Save the Children is doing. I presented that at the breastfeeding seminar, and that presentation is on the FSN network. I imagine potentially Holly might be able to put up that link again. So I welcome you to take a look at that presentation as well for more information. Thanks for the question, Jennifer.
Okay. Are there any other questions? Please feel free to enter in the chat box on the right.
While we're waiting for another question, maybe I can discuss these research questions a little bit more, because one of the there's a lot of guidance and information out there on the power of breastfeeding, let's say. But sometimes we do face this feedback that, yeah, but that data is not from Emergencies. And we do recognize the need for additional evidence of the impact that infant young child feeding in Emergencies can have on both immediate and lasting positive change for children. So this study was taken on by Claudine Prudent and partners as well. It looks at, there was a survey of I think 27 or 30 practitioners in the field, that 27 people from 14 NGOs, universities, and research institutions. They used the Child Health and Nutrition Initiative method, in which they prioritized and ranked the research questions. They used 4 criteria to look at answerability, operational relevance, disease burden, reduction and prevention, and originality. And they then prioritized a number, I think there are 47 questions altogether. These rose to the top as the top 10 questions that we can really make a difference in the field of IYCFE, and importantly for moms and babies. You can see, I hope that you've had the chance to read through some of them and see how your organization can support the collecting of data around this. We just talked about the design of effective relactation interventions. There's a lot of work that can be done around the provision of psychological support to young children's caretakers. Save the Children is currently involved in some research on the management of acute malnutrition in infants. And one of the outputs of that research is identifying that one of the factors that really influences acute malnutrition in infants is maternal mental health. And yet we're still trying to figure out how do we support maternal mental health, most likely in general, but in Emergencies in particular. So there's a real powerful opportunity there to look at that question, as well as calculating the impacts of IYCFE, for instance, in terms of nutritional status, morbidity, and mortality for programs. So maybe if there are no other questions, I love this photo. I was sad I couldn't make it into the core presentation, so I'll just pause here for a moment in support of breastfeeding. But finally, I'll just say thank you. And I know that there are a number of folks on the call who focus on nutrition in Emergencies. And I did just want to call out that these are tools that I've been involved in or that I'm quite aware of. But there are a lot of tools and initiatives and partnerships out there. I see Erin Boyd from OCA is here. I imagine folks from UNICEF are on the call. Andy Kendall, just a shout out, Andy Kendall will be presenting on the Tech RRT later this week. She'll be hosting a panel with folks across different sectors to talk about how we can support and sustain breastfeeding and working with other sector colleagues. That should be an interesting webinar as well. So keep an eye out for that presentation. She'll also most likely be talking about the IYCF Framework again, in case that was particularly interesting to you, and some more examples of the work around the framework. So keep an eye out for Andy's webinar as well. But just to say, there are a lot of initiatives and partnerships that folks are involved in, and that this is just one selection of them. Oh, great, Andy, thank you for that. So Andy just posted that her webinar is happening on Monday. So you will be able to open up World Breastfeeding Week focusing on emergencies and close World Breastfeeding Week focusing on emergencies, which sounds fantastic, doesn't it? So thanks again for joining, and I hope that these tools will galvanize all of us to looking at how we can sustain breastfeeding in emergencies. Thank you.
Thank you so much, Sarah. And as we unfortunately see, the line between development and emergencies seems to be getting thinner and thinner all the time. So there's a lot of relevance to all this information and resources. So do take a glance at least at the material for general awareness. And thank you, Holly, for posting the link up there. I would like to point out tomorrow the presentation will be by the Global Partnership for HIV-Free Survival on quality improvement in breastfeeding ART compliance. We were fortunate enough to have the ASSIST program present a little bit on this at the breastfeeding seminar May 9th to 11th, but they are going to go into more depth tomorrow. What I'd like to point out is that tomorrow only the link to the webinar is different. So if you go to the web page which hosts this, you'll find the link to that presentation. And then on August 3rd and August 4th, we're back to this same Adobe Connect link to continue on. And I made a slight error when I talked about the Sun Civil Society Network webinars. I said that today's would be at 11 a.m. I'm sorry, it's August 3rd will be their first one at 11 a.m. They're hosting each of them at 2 different time slots, but also on different days in an attempt to reach both sides of the globe. So go to www.suncivilsociety.com and you'll find more information on that. And with that, we thank you, and we can all go on with our days refreshed with knowing how many of us are focused on protecting, promoting, and supporting breastfeeding. Thank you, and see you tomorrow.